Let's talk about ways to avoid getting an IV when you're in labor. You might not want it, or you might just be interested in maybe if you have to have it. So today we're going to discuss all of those options. As a nurse who has seen thousands of patients give birth in the hospital, I'm really excited that you guys are here because I think this is pretty misunderstood. Okay, you gotta go into this knowing that I am super pro IV, and there's a few reasons, and they might not be things that you've heard from other people or that you've understood. And the first one is IVs are so much easier to get when everything is calm and your body is cooperating. First off, getting IVs is tricky. I've had so many people like, my nurse had to poke me 3 times. Yeah, it's a really difficult thing. In labor and delivery, we are using a larger IV than they use for lab work or usually even when you go to the ER. On the off chance that we need to give blood, we need a large, like a garden hose that goes in your vein. And so learning to put that in people's veins is tricky and it's not always easy. And please don't be shocked if it takes your nurse 2, maybe 3 times to get your IV in. But it is a lot easier to get that IV in when everything is calm for a couple of reasons. First off, we don't feel a lot of pressure, right? When you come into for your admission, an IV is part of the process most often. I'm feeling calm. I know that I have the time that I need to be able to get the IV. I can become one with your arm. It's really important that your labor nurse look at the veins on your arms, often both arms, to see which one's best, which one they feel the best about. I do have patients every once in a while saying, I'm going to tell my labor nurse where I want my IV. And my response is always, you can say I'd rather not have it there, but if that's where your labor nurse thinks that it's going to be the best to go in, it may be your best option. However, once we get into an emergency where you're losing blood or having an issue, your veins clamp down. Their job at that point in time is to send all of your blood to your vital organs. Make sure your brain's working, your liver, your kidneys, make sure all of that is functioning. That is much more important to your body than your limbs, like your arms. So those blood vessels clamp down. They get really small and they do not want to be bothered because there isn't as much blood in them as there is in your internal organs. So that also makes it really, really, really hard to get an IV in once we hit an emergency state. So I just want you guys to know that going in. IVs also give us quick access should you need to get IV pain medication or you decide you want to have an epidural. It just gives you more options if the IV is already in. Side note, if you're GBS positive, you do need an IV if you're planning to get the antibiotics. They cannot be given orally or in other ways. If you're wondering more about GBS status, I have a whole video on it. I'll link it down below. And finally, if you have an IV in, which it doesn't have to be running, we're going to talk more about that down below. But if we have access to your veins, it gives us quick access in an emergency. We can give you medications, we can give you IV fluids, we can give you blood products. That is so important in labor and delivery. And I know everyone thinks that everything in labor and delivery is sunshine and rainbows, but when things start to go bad, they go bad very, very quickly. And having that IV access can really make a change in the outcomes of a poor situation. I'm not saying this to scare you guys. I just want you to know all of the facts from someone who's been extremely glad that a patient had an IV. Okay, but here, we're here to watch this video. How can we avoid getting an IV? The number one way to avoid getting an IV is to avoid coming into the hospital as long as possible. The reality is, if you come in and that baby is already coming out, we probably won't even have time to get an IV in, but we're also going to have less time for all of those problems that I talked about at the beginning to happen before you have your baby. Now, if you were to come in with a precipitous delivery, which by the way, I have a whole video on that as well, we're still going to try and get an IV in if you are okay with it. We want to have IV access. It's one of the very first things that we're trying to do when we have patients come into labor and delivery in case they start to bleed after they have their baby. That is one of the big times that we're really concerned about this is right after you have your baby, you are at a much higher risk of postpartum hemorrhage. However, the longer you stay at home, the less likely you are to need an IV, especially during labor. And pro tip, we can actually give Pitocin, which is what we usually give in the IV. We can give it in your muscle. Now, it doesn't work as quickly, but it is something that we can do. And I have done with patients who either refused the IV or came in too late and it just seemed dumb, so we just gave it in their leg. The other thing is to not want or need an induction. I've had patients come in who are like, I don't want an IV, but I want to have an induction, and those two things are not compatible. You cannot have an induction of labor without an IV going. You can start an induction of labor, but you need to know that an IV is most likely coming. Now, all of that is dependent on your hospital's policies and protocols, but you have to know that if you're planning on an induction, an IV is part of that plan. But if you are going into labor naturally, you actually have a less likelihood of a postpartum hemorrhage, and you won't need the IV for the induction agents. And the other way to avoid getting an IV is to talk with your provider about it ASAP. I don't understand why people have planned their entire pregnancy that they do not want an IV in labor and delivery, but is not something that they talked with their provider about during their entire pregnancy. Even if you are 13 weeks, I want you to tell your provider at your next appointment, hey, I do not want an IV at delivery, so you can start having this conversation. It is important that they tell you the risks of not having an IV so that you can really contemplate them, beyond what I'm telling you here. It's just important that they know. By the way, an IV is part of your birth plan. I actually have a full free birth plan mini series that I'm going to link to down below in case you're wondering what other things you can avoid during labor and delivery as well. Okay, so you're like, Hillary, great. You're super pro IV. I can't trust you for anything. What is my option then? And the option that I absolutely love is called a saline lock. So it is a little tube that just hangs out in your arm and doesn't have fluids hooked up to it. So we do have to put the IV in. But usually when you come into labor and delivery, you have to get labs drawn anyway. We want to check your hematocrit and hemoglobin and your platelets. And so you're going to have to get stuck anyway. And usually in labor and delivery, we try and do it all in one thing. So we stick you to put in the IV, we get your labs from that, and then if you're getting a saline lock, we just hook a little bit of tubing to it and it's done. It doesn't have to be hooked up to an IV bag. It doesn't have to be annoying. And in fact, if patients are really bothered by it, I usually get like a little stocking dressing that I can put over it to make it, so you don't see it, you don't snag it on things. It's not a big deal. So the saline lock is an absolutely wonderful thing. We can actually usually use it at the beginning of an induction. So we have that access to your veins should we need it. And when we're not using it, it doesn't have to be hooked up to IV fluids. It's not affecting your ability to move around the room or within your bed. It's just a big win. Huge fan of the saline lock. Talk with your provider if that's what you're wanting to do. It should be fine. Unless you are getting an induction or an epidural, then we usually have to have fluids running. Pro tip, even if you're positive for group beta strep, we actually can saline lock it between the times that you get the antibiotic. It doesn't have to be running in all the time. So that can be really nice because I gotta tell you, every time I get an IV, I'm shocked by, first off, how much it hurts to get it put in. I will say that as a nurse, you sort of forget that the more that you're putting in other people. And also how annoying it is, like trying to wrap it around your body when you're going to the restroom or whatever. It's just annoying. So I love the saline lock. It's a great option. And I got to tell you that as a nurse, when a patient refuses an IV and I'm just kind of dealing with them the whole shift, I'm always just a little bit anxious that we're going to need access to the veins. And so when you have a saline lock, it takes that anxiety off of us. We're not worried that we're going to have to do that in an emergency. It's just good news. Now, I also have a whole post on why to avoid an epidural, so I'm going to link that one up above and down below. Are you planning to avoid an IV? And if so, have you talked with your provider? Tell us down in the comments. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.